Now to some health news. Some startling new numbers on diabetes in the United States. A study indicates more than half of all Americans either have the disease or a condition that leads to it. Even more concerning, a large percentage of people don't even know they have it. Erica Pizzi has more.
The prevalence of diabetes is high, and a lot of this is undiagnosed.
A national wake-up call as a new report in the Journal of the American Medical Association shows about half of all Americans have diabetes or symptoms that could lead to it.
And this suggests that we need greater emphasis on screening people at high risk for diabetes.
Diabetes is a major cause of death in the U.S. It increases risk of heart disease and stroke. The U.S. spends more than $245 billion every year to treat the disease, and there are fears the problem will get worse.
The myths that are out there about diabetes is, one, if you eat too much sugar, that will cause diabetes. Well, it's not the sugar that causes diabetes, it's the weight gain that generally is associated with diabetes.
After looking at data compiled by national surveys, federal researchers found 1/3 of Caucasians with diabetes did not know they had the condition. Compare that to 37% of African Americans and 49% of Hispanics. However, the number that surprised scientists was among Asian Americans. More than half with diabetes don't know they have it. It is the first time undiagnosed diabetes has been measured in that part of the population.
This is occurring despite the fact that their BMI is low, relatively low, at 25 compared to the 29 that we find in the general population.
Testing for diabetes is simple, a quick blood test. The hard part is getting more people into the doctor's office. Erica Pizzi, Al Jazeera.
Dr. Devi Parampil is a physician and assistant professor at New York University School of Medicine, and we welcome her in our studio. Good to see you, Dr. Devi.
Nice to see you again.
All right, so address the Asian statistic there. Why? Do we have any sense?
Well, we think it might be related to their body weight or body mass index. So it's hard to separate in this study the weight from the fact that they're Asian. So a lot of them tended to be thinner. Now, because diabetes is associated with obesity, a lot of times if someone who is overweight or obese comes to the doctor's office, they're more likely to get their blood sugar checked or get screened for diabetes. But if someone is much thinner, they may or may not get those same tests done because people will think they're low risk for diabetes.
Does this happen suddenly or does it happen over time?
It takes time. So to develop diabetes, it's really hard to tell when that transition happens because we don't know the exact cause of diabetes. I mean, we think about it as a blood sugar problem, but really it has a lot to do with, let's say, autoimmune disease, where the body attacks itself. So it attacks the pancreas and it causes some dysfunction there, where the body can't release insulin, which is what brings down your blood sugar.
Right.
Now, the main complication of all of this is that when you get diabetes, it's not just the high blood sugar, it's the fact that that affects your whole body. So you can see complications in the eyes with vision loss. You can see problems in the heart, like heart attacks, strokes,
right,
kidney failure.
But if you see that, by that point, you've already got blood sugar that's high, right? Are there any other signs other than the blood sugar test that tell you that you might be on your way to getting diabetes?
There's not a good test. So in terms of the blood sugar, that's usually the first sign that we have. I mean, sometimes people will have symptoms like they get very thirsty or they have to go to the bathroom a lot. But again, that's tied to the blood sugar itself.
What about pre-diabetes? And is diabetes reversible?
Well, that's a good question. I don't know that we know the answer to that, whether it's reversible or not, but you actually can change your blood sugar a little bit. So if you lose weight, if your diabetes is related to weight gain, then with diet and exercise, sometimes with medications, you can kind of lose weight and then perhaps lower the blood sugar. But in terms of the complications that diabetes causes, are those reversible? That's harder to tell. I'm not sure if that's actually possible yet. We still have to find out more about the cause.
And a cure? Would there be? Is science close to a cure?
I think we still need to learn more about what's causing the problem, but science is advancing a lot in terms of a couple different things. So with diagnosing diabetes, we're actually making a lot of advances.
Right.
I mean, there was a peak about 10 years ago where a lot more people got diagnosed early on, so they could at least get treatment and prevent the complications. And then when you think about the problems like heart attacks and strokes, kidney failure, we've had a lot more advances in those areas. So those things are getting better. But in terms of finding a cure to prevent diabetes at all, I don't know that we're that close to that yet.
Interesting information. Dr. Devi, always good to see you.
Oh,
Thank
nice
you
to
very
see you.
much.
Wish I could say more happy stuff.
I know, we do too. But that's part of the deal here. All right, thank you.